Hey, my name is Chris. Thanks for tuning in again. Today's video is going to be focusing on the Green Journal article that came out in June 2021 by Sun et al. What it was looking at was high dose versus standard dose PIT. What they found is with patients that are nulliparous that come in with spontaneous labor, if they put them on high dose PIT regimen for augmentation, they're going to actually decrease their chorio risk. They're going to decrease their labor time, while not increasing their C-section rate and not increasing any clinical outcomes of fetal distress. Hi, my name is Chris, and today I'm going to be reviewing the Sun et al. Paper. So for the background of this paper, kind of like two main reasons. One, oxytocin or Pitocin is commonly used for augmentation and induction of labor. And I went over this in the term prom trial, but there is actually no gold standard on the amount of PIT that you're supposed to be giving these patients. So that was one issue that the paper wanted to address. The second issue was that there was a 2013 Cochrane review, and that review said that, high dose PIT can actually reduce C-section rates. But when they actually removed one of these trials that was suggested to have high bias, there was actually no difference, and they couldn't conclude anything between the high dose and standard dose PIT arms when they reviewed a whole bunch of papers in the review. So there was now this, no clear evidence for what the gold standard was. And then the other thing was that this new Cochrane review, the Cochrane review in 2013, kind of didn't really help suggest on recommendations for high dose PIT. So now this article is really trying to kind of add new evidence to the literature to kind of help suggest the efficacy of using high dose PIT in patients who come in with spontaneous labor. The methods of the paper: this was a single center study done at Northwestern, which has no institutionalized rate at which they're supposed to run Pitocin, which gives them the ability to actually conduct the study. But they took 1,000 patients that were admitted to Northwestern who were nulliparous, who came in with spontaneous labor. And then they assessed them and they put them into two groups after they were consented, and they either got the standard dose PIT or the high dose PIT. Standard dose was 2 milliunits and up by 2, or high dose was 6 milliunits and up by 6. And then they just had them deliver and they looked at their outcomes. The other thing is you got to look at kind of the table for the demographics for the patients. And this right here is on table 1. And what we're able to show is for their age, they're around 31, which kind of mirrors what my institution's like. 66% were white, their BMI was 29, and their GDM was around 2 to 3%, and their hypertension was around 10% or so. So that's their study population that they were looking at, that were part of the 1,000 people that were divided up for the study. When they were doing the study, there was no maximum dose of Pitocin that was actually incorporated, because that would actually unblind it. But what they were saying was that, as you got to 12 milliliters administered, which was either 24 units or 36, then you had to then assess, whether or not you wanted to increase. You had to review the tracing and make sure that there was no category 2 strip or concerns for increasing for the PIT. The primary outcome of the paper was C-section rate. And that was because, the Cochrane review, when they removed that paper, it actually did not show benefit for high dose PIT for reducing C-section rate. The secondary outcomes they looked at were choreo, length of labor, and umbilical artery fetal acidemia. So those are the main things I'm going to be reporting on for the results section. Jumping into the results, for their primary outcome, and this is on another table which I'm going to post up right now, what they showed was that there was no difference between the two arms, the high dose and the standard dose. Interestingly, this is only 14%, which is an incredibly low C-section rate, which is actually pretty impressive, and they kind of comment that later on. But the secondary outcomes that I wanted to talk about as well are listed on this table, which I can put up right now. And what they showed was that, labor duration was less in the high dose group, and that was 9.1 versus 10.5 hours, high dose to low dose. For choreo, it was 10.4 versus 15.6, so the relative reduction rate of 0.67. And for the umbilical artery acidemia, there was actually no difference when they actually did multiple analyses and kind of looked for compounding variables. The other thing that they looked at as well was the PIT dose rate, and what they found is after they assessed what type of Pitocin they were getting for the concentration, so the high dose they were averaging 12 milliunits per minute, and the standard dose patients got 8 milliunits per minute, with a range of 6 to 24 for the high dose and 4 to 12 for the standard dose. Looking at this paper and thinking about it, it can be reasonable, and what they suggest right now in this paper is that, if a patient is nulliparous and comes in with spontaneous labor, it can be beneficial to start them on high-dose PIT because it reduces their chorio risk by 0.67, or their chorio risk is 0.67 compared to those who have standard dose PIT, while with not increasing their C-section risk, which is like, what the issue, right? So if you're pumping people with PIT, right, your concern is tachysystole. Tachysystole leads to staph cysts, and then that would lead to more interventions. The paper doesn't really actually talk about how many staph cysts were done on either group, and I would suggest the standard dose probably had fewer, which in hospital settings that would have, higher volume and less nurse to patient ratio, that would probably be beneficial. But at the same time though, there was no increase of umbilical artery acidemia, there was no increase in NICU admissions, and there actually were no fetal deaths, so they weren't even able to comment on that. The interesting things about the paper that I wanted to talk about was, okay, so yes, this is single center, so that's always something to take with a grain of salt, but they were obviously aware that they were doing the study, and they comment that on the paper, so like the Hawthorne effect, so doing better when you know that you're being observed. And that kind of goes to the fact that like their C-section rate was super low. Like 14% is like super, super low, and it's actually impressive. And that would be interesting to kind of assess what their C-section rate was prior to that study and see if there was, an obvious decline in C-section rate when patients were on high-dose PIT. And I mean, obviously this C-section rate might be different than their non-spontaneous or their inductions of labor. So this is the C-section rate for spontaneous labor patients who are nulliparous. And overall, I think it's like a really good paper. I think it's cool that they're adding more literature to the high-dose PIT, area of medicine. There's not a whole lot out there. And it would be really cool to kind of see if there is, increase, or there's a few other things in the works that they're doing, referring to actually like induction, and seeing if induction at, higher titration rates or higher initiating rates can also have the same effects of reducing chorio. But that's all I have really much for this paper. Thanks for listening, and I'll talk to you soon.